We're here with Leslie Flores, who is a nurse at JFK Medical Center. Leslie, let me ask you, when did you know you wanted to be a nurse? And, double question, how much do you love it?
Oh, well, first of all, I absolutely love it. I don't think any nurse can become a nurse and not love it. You wouldn't be able to put your all into it. But I knew I wanted to be a nurse when a degree in psychology wasn't doing it for me. I wanted to do more for the people. I wanted to help out, and I wanted to know that I made a difference more than that.
Now, let me ask you, I came down here on a tour a while back. We saw you on the tour with some of your colleagues. I was trying to figure, it was early in the day, but I was trying to figure out what's a typical day in the emergency department. Go ahead, take a shot.
Busy. It's organized chaos. I think that's a word that I can give it. Ever since Muhlenberg closed, we've had a challenge. We've had to accommodate a lot more patients in a very small space. So it's been a little bit of a challenge for us, but I think teamwork has allowed us to get through it and make sure that the new things that we've implemented have, helped us all out in a way that we can give the patients the best experience possible.
How much stress?
Tons. It's hard to not take your work home with you. It's hard to just, separate the life and death situations and then go home and have a normal day at home with your family. And you can't really, let it all out to your family, who has no idea what you're talking about. If they're not working in this field, they can't at all understand what you go through. So I think the stress level, yes, it's very high.
We are here in the pediatric unit of the emergency department, and I'm curious, is this different, or how is treating patients, kids, and their families different here as opposed to the other part of the emergency department, even though I know there's a big expansion going on and the pavilion is going to be happening. So go ahead, talk to us about the pediatric piece.
Well, a thing that's different here in peds is that, the patients are children, and they can't a lot of the time speak up for themselves. So as a nurse, you have to be a lot more of an advocate for the patient as opposed to when you have an adult population. With the adults, they can speak up, they can say, hey, this hurts, say this doesn't hurt, I don't like what you're doing. As a patient, you kind of have to step back, as a nurse, when it's a pediatric patient, you have to step back and say, this really isn't what's in the best interest for the patient. And for the most part, with the pediatric population, you have the parents also that are very involved, and you don't have that with the adults. So it makes it a little bit different.
Being a nurse at JFK Medical Center, what makes it so special for you?
The teamwork. I wouldn't want to go anywhere else. I love who I work with. I love coming to work every day and knowing that I still have that strong teamwork and that backbone that'll help me get through the day.